Welcome back, everyone, to part 2 of our Commercial Payer Masterclass Explainer. Today, we are going toe-to-toe with two absolute giants in the commercial insurance space, PPOs and HMOs. Now, as our source text brilliantly points out, when you finally finish coding a claim, your work doesn't just vanish into thin air. It goes straight to the payer. And honestly, you need the coding agility of a cheetah to keep track of all these different payers, to figure out exactly who is supposed to pay you, how much they owe, and when that check is actually coming. So grab your notebooks and let's get focused, because mastering these managed care models is absolutely essential for your survival in the billing department.
Okay, here's our exact roadmap for today. We're going to kick things off with a quick intro to managed care. Then we'll break down preferred provider organizations, followed by health maintenance organizations. After that, we'll look at the PCP Gatekeeper model, tackle the high stakes of out-of-network financial liability, and then bring it all home with a summary and our next steps.
All right, starting right off with Section 1, Intro to Managed Care Organizations.
Before we can even think about jumping into specific plan types, we really need to lay down a critical foundation. You absolutely have to understand the difference between the carrier and the network. Basically, the commercial insurance carrier is just the firm that actually writes the check to the provider. But here's the kicker. The carrier might not be the one deciding what that check is actually worth. You see, a lot of carriers participate in broader payer networks, and it's the network itself that dictates the final reimbursement costs for those claims.
Variety is the whole name of the game here. It's the pivot point around which the entire commercial insurance world revolves. I mean, there is an insurance plan for almost every single circumstance you can possibly imagine. Out there in the real world, in your daily workflow, you're going to encounter a massively diverse range of policies. And that's exactly why it is so crucial that you correctly identify not just the carrier who's paying, but the underlying pricing network too. If you don't, you're looking at some seriously painful, unanticipated write-offs.
Moving right along to Section 2, Preferred Provider Organizations or PPOs.
Whenever we talk about the classic battle between patient flexibility and overall cost, PPOs pull hard toward flexibility. Preferred provider organizations are essentially just big networks of healthcare providers. We're talking hospitals, clinics, physicians' offices, all of whom have agreed with an insurance company to offer their services at lower, discounted rates. The reimbursement conditions for every single level of service are strictly spelled out well in advance within the network's contracts.
So what does this actually mean for the patient's wallet? Well, patients who carry PPO plans usually enjoy much lower out-of-pocket costs at the actual point of service. We're talking lower copayments and lower deductibles as long as they stay within their plan's network. But of course, there's always a trade-off, right? To get those sweet in-network discounts and that broad flexibility, PPO members generally have to shell out much higher monthly premiums compared to members of other plan types.
And here is a massive billing perk when dealing with a PPO plan. Patients often don't even need a primary care referral to go visit a specialist. They can literally just pick up the phone and book the appointment themselves. But hey, coders and billers, you still need to stay on your toes. Just because they don't need a referral doesn't mean you're totally off the hook. You still have to watch out because certain surgeries or diagnostic procedures will absolutely still require you to get a pre-authorization in advance.
Which brings us to Section 3, Health Maintenance Organizations, better known as HMOs.
Now, what's really interesting is when you put these two models side by side, it is a complete flip in strategy. We just talked about how PPOs come with higher premiums, maximum flexibility, and zero referrals. Well, HMOs totally flip the script. They attract patients by offering highly affordable monthly premium rates and incredibly low, sometimes completely non-existent copays. But the catch? In exchange for keeping all that money in their pocket, patients are locked tightly into a very strict, closed network.
Let's look at how this translates into actual, everyday care delivery. HMOs basically create a fully comprehensive, self-contained patient service network. They contract directly with a specific list of general practitioners, specialists, labs, and hospitals. If a patient wants their HMO benefits to actually cover their visit, they literally have no choice but to get their care exclusively from this pre-selected, contracted menu of providers. Step outside that menu, and they're on their own.
Let's dive a little deeper into this with Section 4, the PCP Gatekeeper model.
In an HMO setup, patients can't just freely wander around the network booking whoever they want. They are required to go through a primary care physician, or PCP, who is specifically assigned to them. This PCP acts as a gatekeeper, and I want you to think of them not just as a doctor, but as a rigid clinical and financial checkpoint.
Their primary job is to keep overall healthcare expenses strictly contained and under control for the insurance company.
Let's walk through this mandatory clinical pathway, step by step. First, the patient selects their assigned PCP. Second, when an issue pops up, that PCP has to evaluate them clinically. Third, if the doctor decides a specialist is actually necessary, the PCP is the one who issues the formal referral. And then finally, step 4, the patient gets to see the specialist. But remember the golden rule here. Even with that shiny formal referral in hand, patients are strictly required to see a specialist who is already affiliated with the HMOs network. No exceptions.
All right, let's get into Section 5, out-of-network financial liability. This is where the stakes get high. Let me just throw this question out to you to really highlight the massive financial exposure we're talking about here. Who actually pays the bill when a physician who exclusively works with PPOs ends up treating an HMO patient?
Well, the liability rules are frankly pretty severe. Why? Because a lot of HMO plans offer absolutely zero out-of-network benefits, none. So if that PPO doctor treats the HMO patient, depending on how the PPO contract is written, the provider themselves might actually be forced to absorb the cost of that care entirely out of their own pocket. On the flip side, if an HMO patient sees a physician who has no contractual agreement with their firm at all, well, the patient might suddenly find themselves 100% financially liable for every single charge.
Seriously, let this quote be your ultimate survival tip in this industry. Always check patient benefits in advance to safeguard the provider as well as the patient. In the complex world of commercial managed care, simply assuming a patient has coverage just because they flashed an insurance card at the front desk is a one-way ticket to disastrous financial write-offs. Make this your absolute rule of thumb.
Wrapping things up today with Section 6, Summary and Next Steps.
So, to boil down these structural trade-offs as clearly as possible, flexibility and cost control are basically on a seesaw. They are inversely related. PPOs give you high flexibility, no referrals needed, out-of-network options, but they offer very low cost control, which means higher premiums. HMOs are the exact opposite. They offer very low flexibility thanks to the strict Gatekeeper and the closed network, but they provide incredibly high cost control, giving patients much lower premiums and often zero copays.
So, you've conquered the two heavyweights today, but what's next? Well, coming up in Part 3 of this Masterclass Explainer, we are going to tackle the hybrid and specialized models. Get ready, because we'll be diving into point-of-service plans, exclusive provider organizations, high-deductible health plans, and those notoriously tricky discount plans.
But before I let you go, I want to leave you with one final provocative thought about the real-world impact these structures have on patients. Are the remarkably lower premiums of a strict HMO Gatekeeper network truly worth the catastrophic financial risk of a potential out-of-network emergency? It is a serious gamble that millions of patients take every single day. And as billers, you are right there on the front lines managing the fallout of that risk.
Thank you so much for joining me for this explainer. Keep that coding agility sharp, and be sure to like, share, subscribe to Decode Healthcare with Harshal. Catch you in Part 3.